Rush Hour is just getting started on Beaver County Radio. It's time for Driving in the Fastlane with Frank Sparks. It's the show that talks about what's happening in the news, locally, regionally, and nationally. There will be guests, and Noah Haswell will have the news at the top and bottom of each hour. And now, here is the host of the show, Frank Sparks.
Hey, good morning and welcome in on this Tuesday morning. It is June the 9th of 2026. Today we're going to start out hour number one, visiting with our good friend Brandon Antinopoulos from Forward RX. And we'll have an open talk in hour number two. Originally we were supposed to have Rick Mattia from NAMI, but Rick had to reschedule. So we'll have open talk in hour number two. And got a couple things on the subject. Number one, the water, as a lot of people have been discussing for some reason. I haven't had a problem, and I have Beaver Falls Municipal Authority water, but we'll talk about that at 11 o'clock. But anyways, let's say good morning to Brandon. Good morning.
Hey, good morning.
How are you today?
I am good.
Good.
I'm good.
You know, we've got a lot we're going to talk about today. We're going to talk about this new program with the GLP-1s. That's pretty cool.
Yeah. A lot of new information there, and not a lot as far as I've seen it kind of being discussed or awareness around it. So felt the opportunity we could, be the ones to talk about it here.
Seems like that's the biggest, hugest trend going on right now.
Lot of popularity in headlines, with those medications. Not even just with the ones that are available now. Some of the products, the ones that we're going to talk about today, specifically the ones marketed for weight loss. I've seen Wegovy is Novo Nordisk's medication. Lilly, the manufacturer, they have both Zepbound, which are the injections that have been around for a while, and then they have a new tablet called Foundayo that's available. But even some of the research and studies that have been released within the past few months on newer agents that manufacturers are working on coming down the pipe in the next couple of years with approvals. It's fascinating, at least the research and what's being presented. Again, I don't want people to take away that these are kind of like magic bullets for all things, that ails us in U.S. health. But as far as not just for weight loss, but for other things such as cancer risk reduction, even for, some other things outside of just diabetes and weight loss, what they were intended to do. Some of the results are promising, but they do have their side effects.
They do have their downfalls as well, correct?
Yeah, absolutely. Okay. And also, we'll talk about it a little bit today, but even for weight loss, don't think that you're going to be able to give up diet and exercise and lifestyle changes and then do these instead. Still a lot of considerations for everyone to take a look at and make sure that they're going to still be on top of their health while being on those medications, especially with diet. Because if you're not, can lead to some pretty serious adverse effects. So, we'll talk a bit about that today and some of the things that CMS and Medicare are doing specifically to make those medications more accessible to Medicare-eligible seniors than they have been in the past.
Well, it seems like, too, over, I guess, maybe the last year, they've gone from just the injections, but now they also, a lot of these companies have a pill available as well.
Yeah. So a lot of that comes down to what they've studied and said that, so when you have a medication, from a manufacturer standpoint, doing something injectable that you can get directly into the body, bypass the body's metabolism and breakdown in the stomach and things like that, helps ensure that you're going to get you're not going to face any absorption issues. Sometimes even if we take the same medication by mouth, depending on what we eat that day or don't eat that day, or if we take it with the meal, without a meal, how much of that medication gets absorbed could be impacted. And in the case with, early on with the GLP-1 medications, if someone were to take a tablet by mouth, it would basically be useless. It wouldn't hurt you at all, but your stomach would break the whole medication down, make it inert. And so all that money you're spending on that medication would not get absorbed. So that's why we've had the injectable versions that bypass that. But what they found was, usually after 2 or 3 months, if someone was experiencing some of the side effects, even if they were minor, you're kind of like, do I really want to be injecting myself, daily or weekly with the newer ones and keep going through this process? Probably not. And they would stop taking the medications. So the manufacturers invested a lot of money to look at ways with new technologies that they could actually protect the active medication in that oral tablet form so that it could bypass your stomach acid, breaking it down so that it actually can get absorbed. So that's why now you have tablet versions, even though they're once a day tablets as opposed to the once weekly injections. Whenever they, study or survey patient groups or who potentially could take them, it still seems that a once daily pill is a preferred way of taking medicine over a once weekly injection. But that's why at least now you're starting to see that, even if it's the same active ingredient, they're coming out with their tablet forms because they at least now have the technology to protect that active medication so it can bypass the stomach and get absorbed in your system.
A lot of these websites that are selling these are like, this is the newest weight loss. You can get it, the Wegovy or whatever pill in a pill form, and it's a lot cheaper.
Yeah.
But in the end, it ends
Please
up...
avoid those sites.
Well, if you really look close into it...
Yeah.
Because, a lot of times these are things that come up, so I explore into them just to kind of see. So I look into it and I see, and it actually, they want you to pay for the pill, but then they want you to pay for a subscription so you can talk to their doctors throughout the time too. So it ends up, God, I mean, it's a big chunk of change. And let's be real, as you get older, and maybe is this the government's way of recognizing that as people start to age and get older, obesity is probably one of the number one things that causes their health issues?
Yeah, absolutely. So I think that's been the question with these medications, because they are very expensive. Like regardless of what your copay or out-of-pocket price is, for the injectable versions for weight loss, it costs the pharmacy over $1,300 a month to get one of those medications in to put it on their shelf. And that's what they're, billing to the insurance company. There are some programs now, direct through the manufacturer, discount programs that, depending on what the dose, would make that between $149 a month to like up to, I think at the most is $349 a month right now.
It's not bad, but
no,
compared to what they are.
And even what they used to be. Yeah. I mean, that's at least now, you have two manufacturers that are like the predominant ones that make these medications, and you're probably going to see other ones start to get in the mix. And the interesting thing about these particular medications, as you said, is because there is this almost like a high demand for them, or this willingness to say like, hey, they're not covered by my insurance, but I can get it for this price a month. I know it's going to be this price. Am I willing to spend that much? For some people, they have the means to do so and they think it's worth it. For other ones, maybe not. But I think as you see more, because it's not usually covered by insurance, what we're finding that there is this whole market for direct pay, kind of what we do at Forward RX. It's like, hey, we just mark it up based on our costs. Here's the price. We're usually a lot less or the same as a copay on some things. Some other things we may not be, but here's the price. You decide for yourself, is the service, worth it or not from getting it from us. And so as you have more manufacturers start to make theirs, and because they're not routinely covered by insurance, you're going to see, and we've already seen it play out in this past year, you're going to see like a price war or a bidding war. Like that's how manufacturers are going to have influence over, which ones patients are going to want, as long as they're FDA approved and they work and minimal side effects. Patients are going to look at the price tag because they're the ones paying it for themselves. And if they notice like, hey, we're not really, moving a lot of our product these past few months, like, what are we going to do? Well, we're going to have to lower
Right.
the direct patient price.
They'll end up policing themselves in the end.
Exactly. So, and this is pretty unique because we never really had this, especially with brand name medications. It was always dictated by insurance companies. They would make their medication, and for, yes, they go out and market it to local prescribers and inform them of, the benefits, and they would fund the studies. But ultimately, if a patient was going to take it or not, the insurance companies held all the power. And they were the ones that say, hey, unless you give us this kickback rebate, we're going to not put it on preferred tier unless you play ball with us. But for this class of medications, it truly is, you're going to see a competitive price process. And which is why, is what we're going to talk about today, this Medicare starting July 1 is going to have a demonstration project, what they're calling the Medicare Bridge Program. That are going to be able to get Medicare eligible beneficiaries access to these medications for $50 a month.
That's awesome.
Yeah. And even the net price that the government's going to pay for these is $249 a month. So, but the way they're doing this is they're cutting out the insurance companies. So even though this is for Medicare eligible beneficiaries, they are negotiating directly with the manufacturers, and they're going to work through a process that even if you have Medicare insurance, your insurance is not going to be involved in this. And this is going to be something that the pharmacy is going to work directly with Medicare's processor that they chose and the manufacturers. Because even the government is now starting to realize that by cutting out all the insurance middlemen, they're going to get a better deal, and there's not going to be any of this funny money profit steering happening. So, for us with ForwardRx being open for over 2 years, we've been kind of, shouting this out on top, like on the mountaintops of how by going direct and bypassing insurance middlemen where it makes sense, actually reduces healthcare costs. The government is starting to recognize this too. At least Medicare is. It's not a fix. My hope is that we would just, hit the reset button and apply this to everything, and not have another side program that's another Band-Aid on top of what the true issue is. But at least they're going to do this over the next 18 months to study it. But the government is going to, this is going to be impactful because it's going to look at these medications and say, yes, these are high price tags, but should we look at these as investments into improving Americans' overall health so that by the time they get older, it actually does save the Medicare program a lot of money by getting people healthier before they need Medicare, as opposed to what happens now is the older you get, the more sick you get, and the Medicare program ends up being the one that pays the highest price tag for having unhealthy individuals. So we'll see. It's a good program to, like I said, improve accessibility of these medications. I think $50 a month, especially for something brand name, is an appropriate price point. And it sounds like, at least with Medicare working direct with the manufacturers, they're going to save the Medicare program some money as they're rolling this out and going to invest in making this accessible, a whole class of drugs that hasn't been accessible to Medicare beneficiaries before.
I think the insurance companies got mad too because they got snookered at first. I've talked to my doctor about this previously because obviously I'm not the skinniest thing in the world. And he told me what happened was once they discovered that these GLP-1s were good for weight loss, they started prescribing them. Well, then the insurance companies caught on, and the insurance companies started denying at that point. So now you have to have one heck of a reason why you need that GLP-1 from an insurance company, with their approval before they'll approve it at this point. And that's because so many people used it for weight loss.
Yep.
So now moving forward, do you see, as we're talking about programs like this and them policing themselves, do you see this being more readily available to people at a more cost-efficient rate than what it's been recently? Because right now, if you want to buy it out of your pocket, somebody like myself, it's going to turn 60. You're looking at what, $1,600, $1,700 a month? sometimes?
Without any sort of manufacturer program, or even if you tried to do it through insurance, also, it's seeming to be the lowest cost option. If you end up getting it approved for diabetes, there's the same medications, but then you have Ozempic and Mounjaro are the ones that are specifically approved for type 2 diabetes. If you go through the process to get it covered, again, your out-of-pocket costs can vary depending on the premiums you pay or what plan you have. It could be very good, or it could be very bad. Chances are, if your insurance is an employer-sponsored program, so you get insurance through work, a lot of employers are starting to make the decision or look at this trend and say, like, hey, you know what? If you can get it cheaper than what your copay would be through our insurance with us covering it, we're just not going to cover it, and go buy it through the direct-to-consumer, like, manufacturer program price. Heck, we'll even set aside money in your HSA fund each month so that you could afford to pay for it. So maybe it is like, after it's all said and done, it's like it's actually covered. But since you can get a cheaper price doing the self-pay price than it would be through insurance, we'll just do it that way.
And I can get that through your pharmacy?
So we actually are we're set up, and we're getting ready to implement it within the next week, that we'll be able to offer those medications at that advertised direct-to-consumer price.
Okay.
Yeah. So
which is about what?
The $149 a month up to $349 a month.
Okay.
So it just depends on what the dose is. Usually, if you're starting out on those medications at the lower dose, it's $149 a month. And as you go up in higher doses, it could go to $249 or $349. But I remember even at the beginning of this year, through those same programs, $349 was like
bottom of
the lowest.
Bottom of the barrel.
Yeah. So in 6 months, we've already seen that price drop down. So I anticipate, I don't see the price ever going up through those programs. I anticipate as we get through the end of this year, even into next year, you'll likely to see those self-pay out of pocket
you said, with
prices
the competition
go down.
too, that'll.
Yeah, exactly.
And then you do have to have a prescription for this, correct?
You do have to have a prescription.
Okay.
Yeah, you do have to have a prescription from your doctor. And then with the Medicare program, so this Medicare Bridge program that begins July 1, it's Medicare beneficiaries that have a prescription drug plan. So even though the insurance company has nothing to do with this, part of the eligibility requirements is that you have to have be a Medicare beneficiary that has a standalone prescription drug plan, or have one of the Medicare assured plans that has a prescription drug benefit as part of that, one of the Advantage plans. You also have to have, and again, these are specifically for weight loss only, is what this bridge program is going to be. Medicare does have some requirements of the insurance companies that they cover. The coverage can be variable, but at least the ones for type 2 diabetes. So if it's for type 2 diabetes and some other already FDA approved conditions, you'll still go through the traditional pathway through your insurance company. But if you want to get it for weight loss, if your body mass index or your BMI is over 35, if it's over 30 and you have a history of heart failure, uncontrolled high blood pressure, like already being treated for a couple medications, and as well as chronic kidney disease, you would be eligible. And then I believe it's also if your BMI is 27 and higher, and if you have some other like comorbid conditions, like already had a history of a heart attack, already had a history of a stroke, if you've been diagnosed with pre-diabetes, and then also if you have peripheral artery disease, you would be eligible. But it's going to be a prior auth process. So your doctor would send the prescription to a pharmacy just like they normally do. Pharmacy would try to bill it to the Medicare Bridge program, which would trigger that a prior authorization is needed. Your prescriber would electronically complete the prior auth, just like they do with some other ones, and then CMS would decide if it gets approved or not. And then after that, you would be able to get that medication for your $50 out of pocket. That's the process. However, I can tell you one of the reasons I wanted to talk about it today, because we may be eligible to participate in this program. You know, we're out of network with Medicare, but since this is going to operate outside of Medicare insurance, we should know more within the next week or two whether ForwardRx can still participate in this program or not. Because one of the reasons I wanted to talk about today, your pharmacy does not know this is coming. Chances are your prescriber does not know this is coming either. I think those of us that just kind of like nerd out over all things pharmacy and accessibility are aware of this. So that's at least why I wanted to talk about it today, to make sure everyone's aware of this is coming. But if your pharmacy, if you go to your pharmacy and ask them like, hey, when's Medicare Bridge program will roll out for GLPs? And they look at you with this like, what language are you speaking face? Right. Chances are you probably need to find a different pharmacy.
Gotcha. All right, we're visiting this morning with Brandon Antinopoulos. He's here with his monthly visit from ForwardRx, and we're talking GLP-1s. We'll open the phone lines after the news, and you can call with any questions you might have that he could help you answer possibly at 724-774-1888 and 843-1888. We also, a little bit later on, before the end of the show, we got to debut the ForwardRx NASCAR that I come up with.
Oh, yeah. Yeah, we talked about that last time.
I even put it at Charlotte Motor Speedway, which is where I was a couple weeks ago. So we'll have to debut that a little bit later on.
I'm excited for that.
All right. Coming up, Noah's Got News in a minute here on Beaver County Radio.
Luann's Route 68 Food and Spirits in Industry is the place for wing specials on Thursdays, fish, homemade crab cakes, and crab-stuffed mushrooms on Fridays, as well as karaoke night. Luann's Route 68 Food and Spirits is known for their famous steak salads and has happy hour from 4 to 6 p.m. Monday through Friday. Find Luann's Route 68 Food and Spirits on Facebook for daily specials and live music. Luann's Route 68 Food and Spirits in Industry is veteran-owned and looks forward to serving you today.
Put freedom in your future. Freedom United Federal Credit Union in Rochester.
The NASCAR Cup Series.
Field works their way 2x2.
Returns to the tricky triangle.
Whoa, spin! Cody Ware gets turned in the face of the field.
For a 400-mile battle at Pocono Raceway.
They're crashing mid-pack. Carson Hocevar will come to the line and the checkered flag.
It's the Great American Getaway 400. Presented by Visit PA.
The views and opinions expressed on WBVP and WMBA are those of the participants and host. They are not necessarily the viewpoint of WBVP and WMBA, its staff, management, and advertisers. Thank you for listening to WBVP and WMBA.
Looking for something fun and delicious to do? Cruise on over to Hank's Frozen Custard and Mexican Food from noon until 3 p.m. on Sunday, June 14th for the second of 6 cruises this year. We will have a live broadcast during the cruise, and our Beaver County Radio Birthday Prize will make an appearance with great prizes. While you're at Hank's, you can enjoy some of the finest custard and Mexican food in the area. Beaver County Radio's live broadcast at Hank's Frozen Custard and Mexican Food is being brought to you by Falcone's Moon Township Ford, where friends send friends, AK Nahhouse Appliance, Furniture, Mattress, and TV, you'll do okay with AK, Moon Honda, Monroe Auto Body, All Access Truck and Auto Sales, GNU's Body Works, and Beaver County Radio.
Attention Western Pennsylvania sportsmen! The annual Syria Shriners Sportsman's Bash is coming Saturday, June 20th, and we're giving away more than $62,000 in prizes. Win premium firearms from Daniel Defense, Benelli, Browning, Colt, Smith & Wesson, Beretta, Marlin, Kimber, Weatherby, and more. Your ticket includes food, beer, additional prize raffles, and a full day of excitement under the pavilion. Tickets are selling fast. Visit SyriaShriners.org to secure your tickets before they're gone. That's SyriaShriners.org for tickets.
Hamlin Hones Championship Chances. I'm Susie Armstrong. The story next on NASCAR Today.
Nothing given, everything earned. What does that even mean?
We have trouble. Big accident.
It means fighting for space while fighting for your place in the moment and for history.
That's how you do it right there.
You want pressure? Mere inches, seconds apart. That's pressure. Defiantly unapologetic. Authentically NASCAR.
Hell yeah, boys!
The NASCAR Cup Series brought to you by Xfinity at Pocono. Sunday at 3 p.m. Eastern on Prime.
NASCAR fans, iRacing Studios brings you NASCAR 25. Race hundreds of the biggest stars of the sport on top tracks from Daytona to Sonoma. Start your career in the ARCA Menard Series and work your way up to Cup while managing team members, sponsors, and more. Or compete online with NASCAR fans around the world. NASCAR 25, available on PlayStation, Xbox, and PC. Head to NASCAR25.com to buy now.
Denny Hamlin closed the gap in the NASCAR Cup Series championship standings with his victory in Sunday's event at Michigan International Speedway. An early exit for points leader Tyler Reddick was exactly what Hamlin needed to narrow the advantage of his 2311 Racing Pilot.
Listen, I knew the only way we ever could catch him is he was going to have bad luck. I said it weeks ago. He had bad luck today. We were in the same wreck. We were turning around backwards. Luckily, no one hit us. We overcame it. But it's like, he's going to stretch it out at San Diego, Sonoma. I still think he's in a really good place, but if we keep doing this, it'll keep him interesting and honest for sure.
I'm Susie Armstrong. This is NASCAR Today on the Motor Racing Network.
Beaver County Radio's news source. 99.3 FM, 1230 WBVP, and beavercountyradio.com. Here's Noah Haswell.
Good morning on this Tuesday, June 9th of 2026. We will have a complete Beaver County radio weather forecast after we take this look at news. The Center Township Police Department recently addressed multiple complaints about children operating e-bikes recklessly in the township park, saying the behavior has created safety concerns for pedestrians and resulted in several instances of property damage. In a statement, the department said it has observed a notable decline in both unsafe e-bike activity and park damage over the past week. Police thanked residents for their cooperation and encouraged parents and guardians to continue supervising children who use e-bikes and electric scooters. The department said maintaining a safe environment in the park requires cooperation from the community and expressed appreciation for residents' continued support. Firefighters responded to a kitchen fire at a home on Crestmont Drive in Hopewell Township shortly after 5:30 p.m. yesterday. The Hopewell Fire Department was dispatched to the residence after reports of a fire inside the home. While crews were en route, law enforcement officers arrived and reported smoke coming from the structure, prompting officials to upgrade the response to a second alarm. Firefighters arrived and quickly worked to bring the fire under control. No information on injuries or the cause of the fire was immediately available. Pennsylvania State Police in Pittsburgh reported yesterday that 31-year-old Matthew Francois of Canada was arrested in connection with an alleged theft scheme involving packages containing precious metals at a FedEx facility in Robinson Township. Francois was charged with offenses including theft and was released Saturday on a non-monetary bond, according to police. State police said the organized crime unit was contacted by FedEx Security on or about May 17th regarding multiple packages containing gold and silver that had allegedly been stolen. Investigators said they arranged for a bait package containing purported precious metals valued at about $75,000 to be shipped to a location near the FedEx shipping office in Robinson Township. According to police, Francois attempted to pick up the package Friday and used a false identification card and tracking information to obtain it. He was taken into custody and was transported to the Allegheny County Jail to await arraignment before he was released. As more people spend time outdoors during the summer months, eye specialists are reminding residents to protect their vision from seasonal hazards such as sun exposure, allergens, and preventable injuries. Physicians with Allegheny Health Network's ophthalmology say simple precautions can help reduce the risk of common summertime eye problems, and tips that AHN experts recommend can be found on our website at beavercountyradio.com. And PennDOT District 11 announced that drilling work on Route 65, Mercer Road in North Sewickley Township is scheduled to begin today, weather permitting. The work will take place weekdays from 8 a.m. to 4 p.m. through June 19th on Route 65 between Brighton Road and Grandview Road. The roadway is currently restricted to a single lane of alternating traffic controlled by stop signs. Beginning Thursday, flaggers are expected to be on site to assist motorists while crews conduct roadway borings. Crews from Armstrong Drilling will perform the work.
Here's the Beaver County forecast.
Today it'll be mostly cloudy with a chance of showers and thunderstorms, mainly in the afternoon through the evening. We'll reach highs of 84 and drop down to lows of 69. And tomorrow look for gusty winds with rain and thunderstorms likely, and some of those storms could be severe at times. Expect highs in the mid-80s and lows of 72. I'm Lisa Marie with your Beaver County weather.
On this Tuesday, June 9th of 2026, at 40 minutes after 10, we have got a temperature of 80 degrees with partly cloudy skies currently in Beaver County, and that's a look at the news for now. I'm Noah Haswell on 99.3 FM, AM 1230 WBVP, 95.7 FM, and 1460 AM WMBA. Also streaming live around the world at beavercountyradio.com.
Weekday mornings were meant to drive in the fast lane. It's Frank Sparks on Beaver County Radio.
Back on Driving in the Fast Lane, visiting in hour number 1 with Brandon Antinopoulos. He's here for his monthly visit, and this month we're talking GLP-1s and a new bridge program that Medicare will be having that can assist you, and it's only $50 a month, which is great. So you have to be on Medicare to be part of this, correct?
Correct. Yep. Medicare beneficiary with prescription drug coverage. Okay. So whether it's a standalone prescription drug plan or if it's a Medicare Advantage plan that has prescription drug benefits in it, that's the overall population who is eligible. So even though this is going to operate completely outside of your insurance, those are still the eligibility requirements for who's going to benefit from this program.
So one of the things that, because the way they advertise this and the way they present these GLP-1s is, oh my gosh, you're going to take this and 2 weeks from now, you're going to be 50 pounds lighter.
Everyone's happy. Everyone's happy on them, or at least based on the commercials.
Right.
And I always joke because even my son, we're watching, we have like an Apple TV box and we watch everything streaming. And he always says, Dad, how come there's so many drug commercials whenever we watch these things? I'm like, well, they know I'm a pharmacist, so we're probably being targeted. So it's all, drug ads. But yeah, they're the marketing folks that they have, they show this as like, your life's going to be changed instantaneously as soon as you start taking one of these.
Yeah, it's crazy. And the funny part is when you really start to look at the fine print as they're going along during the commercial, what's the average? It's not a lot per month, but it takes time to lose the amount of weight that they're talking about. What's the average somebody loses, like starting out on something like this?
Yeah, absolutely. So it depends. The Zepbound is the one that showed, as they would say, most effective for weight loss. I think up to 26% of weight was lost, but it's usually could be up to an 18-month to 2-year period. So it's still, again, you may see some results initially within the first few months, but as far as the effectiveness, the studies that always get quoted, you're usually talking at least 18 months of whenever it was shown. The oral tablet versions, not as effective as the injectables in terms of total weight reduction that they saw. Depending on which one it is, that's usually somewhere in the 15 to 18% weight reduction. So still pretty good as an effective option. But even with those, long period of time, and also it's important to note. It wasn't just doing the injections and taking the pill. All these studies, and even it's approved for in addition to lifestyle change, so diet and exercise. And even to minimize the side effects of these medications, the diet piece is extremely important. So even though it may come across that everyone's all happy and life was changed instantaneously by the only thing they had to do was, do the injection or take the medication, this truly is, whether you take the medication or not, an entire lifestyle change that I don't think gets talked about enough.
So we just can't sit on the couch and eat a bag of chips and take shots and think it's going to be a miracle.
No, I mean, you may see some weight reduction, but you could also see some other adverse effects, in addition to losing fat. Also, muscle wasting if you're not getting the right amount of protein and even fiber in your diet. Other GI issues and whether it be nausea, vomiting, constipation, you can see with that also. And then, even impacts of our, bone health and bone strength. So again, the American College of Lifestyle Medicine defines, 6 pillars of a healthy lifestyle. And whether you take these medications or not, this is something like everyone should be doing. Appropriate diet. And we all know like the American lifestyle and the American diet is really one of the leading causes of chronic disease that we have in this country. But avoiding highly processed foods, avoiding added sugary drinks and meals. So diet, exercise, and it doesn't have to be, something crazy, even if it's just like 30 minutes a day of, some moderate, get your breath and your heart rate up, exercise a day. Making sure we have adequate sleep. Stress management techniques. So whatever we do to kind of like minimize our stress levels. And again, life is very stressful. Positive social relationships is very important to a healthy lifestyle, as well as avoiding any risky substances like drugs and alcohol. So even whether you take these medications or not, but those 6 pillars of a healthy lifestyle are extremely important. But if you're going to start these medications, they become even more important, especially the diet and the exercise, not only to have better results, but to maintain those results as well as minimize any adverse effects of taking the medication alone.
Have you seen the new way that they're marketing it now? It's all over social media and other places. Say goodbye to food. That's how they're marketing it now. I'm like, okay, what's the effectiveness of this? I mean, but there are a lot of downfalls, as you're talking about. So how do you wade through those, and what do you recommend to people as they start these? Because obviously even though the doctor prescribes it, the doctor's going to talk to them, and I'm sure as a pharmacist, you're going to say, hey, you're going on this medication. This is how you have to take it. This is what you have to do.
Yep.
So how do you wade through the positives and the negatives of all this?
Yeah, sure. That's a good question. I would approach it as if I do talking to anybody about any medication or any treatment or any intervention. Understanding why they're being prescribed this medication or even why they want to be on the medication. So understanding, okay, exactly what are we treating here? And then, if it is for weight loss, yes, these medications are very effective for that, in addition to diet and exercise and lifestyle change. And making sure, and we talked about it here before, I think too often healthcare providers or just the system in general, we kind of only focus on, hey, here's the benefit, and, gloss over the, here are the side effects or the negatives or the adverse risks. Like even though they could be very rare and very small, I think we should still make sure that we go over them, or patients are aware before they put anything in their bodies.
Right.
Say, okay, here's the positives, here's the risks, and here's the negatives. And everyone's benefit risk tolerance is a little different, but at least, that's how I would approach it in talking with anyone, to say, hey, here's the benefit you have to gain. here's what you could be giving up or what you could be risking by starting this. How does that sound to you?
Right.
And helping them, understand even if the risk doesn't outweigh the benefit, what are some alternatives out there that we could do? And in particular with these medications, no matter what, diet and exercise and lifestyle change is going to be key, whether you take these medications or not, but just avoiding chronic disease altogether. BMI, or the body mass index, is looked at as kind of like the clinical marker or measure if someone is, overweight or not. But it still is possible to have an elevated BMI, but still be perfectly healthy with all the lifestyle changes. And so again, taking a holistic approach of looking at treating the person in front of us versus trying to treat a number or just for the sake of getting a number lower. So it's, everyone's a little different, but I think the standard approach is saying, yes, here's the benefits, here's what it's going to take to get those benefits, and here's what you're going to risk by trying to achieve those benefits, or here's what life's going to look like. How does that sound? Do you still want to move forward? Yes or no?
But what about maintaining? That's the whole thing when it comes to GLP-1. So once you start these, you're on them forever at that point, or? So
it hasn't been definitively someone said, come out and be like, yeah, you're on these forever.
Right.
The way I assess and interpret the data and the research is it does looks like even with diet and exercise, whenever you come off these medications, for whatever reason it is, usually people stop the medications because of adverse side effects or because they think, hey, I've seen the benefits.
I've lost enough.
I've lost the weight. I'm going to maintain the lifestyle. I'm going to save some money by coming off of it. There's a high percentage within those cases that even after 4 months, you see that weight gain come back. May not be exactly where you were before, but it's pretty close. So to me, whenever I talk to patients about it, I'd say, if you start this, chances are for you to maintain this effect, at least for right now with the medications out there that we know, you're likely going to be on this for, the rest of your life. Or if you stop taking it, there's a pretty good chance that even if you do everything that you're supposed to, a good portion of the weight gain is kind of going to come back. Again, letting everyone know that that's a reality and make the decision for themselves of, is it worth it or not? Is it worth the $50 a month? Is it worth the $149? Is it worth the $1,300? Whatever the price, may
Let me ask you this. So at what point does it maybe become harmful? Because most of these medicines are made for diabetes. And obviously if you're obese, as you get less obese, more than likely your diabetes would come down. If you don't have it, like your borderline, that would help, correct?
Yes.
So what point would that medicine actually maybe cause a bad effect on you, like, your sugar's too low or something like that? Would that be a possibility? Or
with some diabetes medications, yes. With these ones, the risk of having too low a blood sugar, we don't see that.
Okay.
With these ones, so I don't think that would be one of the side effects to worry about or look out for. The ones that you would see, again, is more of the stomach and GI side effects, as well as the more like the losing muscle mass and the impacts to bones also. Those are some of the ones, and there are some cancer risk, pancreatic cancer, and some other cancer risks to kind of look out for that can monitor. I think that's one thing that we're not going to know until we see long-term, 10 or 15 years or now down the road, what truly is long-term adverse effects from being on these medications.
Because you really haven't had anybody that's been on them for a long period of time at this point.
No, I mean, patients with diabetes, one of the first GLP-1 medications was Victoza, which is liraglutide. That one's been out for a while. There's actually a generic of it available. It's a once daily injection, very good for lowering blood sugar and lowering A1C. Not as effective for weight loss as some of these newer agents are, but it was kind of what they, noticed as patients were for diabetes were taking this, and they're like, oh wow, we see a decent amount of patients starting to like lose some weight, and that's when the drug makers thought like, oh, maybe we have a weight loss drug on our hands. It's kind of this similar story with Viagra and Cialis originally. Those were being studied for pulmonary hypertension, and then they noticed the particular side effect from some of the male patients that were taking the medication, and they were like, oh, maybe we got a different drug on our hands that we can remarket.
Right.
So, you do have some patients with diabetes that have been on once daily Victoza injections for, a long time since it's off patent. But, these newer medications were probably still 6 years at the most that they've been out or around, as far as like Ozempic and Mounjaro. But the mass of which they're prescribed now and used now is probably within the last 3 years.
Shocking they're using it when they don't really have a baseline. You know what I mean? It's shocking that they use it as much as they do, because there's really not an endpoint at this point right now.
Yeah, I mean, all medications, before they have to get FDA approved, they do have to go through certain research and studies to show that, one, it's effective, and then also to establish what a safe dose is with the like minimum side effects, or at least say, hey, in this population, we've noticed this side effects, and that's what gets kind of like published, and even all the list of the stuff that they go through during the commercials. But as part, and they all have to go through what's called post-marketing surveillance. So it's kind of like, hey, it's been marketed and it's out there, but now we have to take a look at, as our medication is being used more broadly, are there side effects that are popping up at a higher rate than what we noticed in the smaller population of the trials? And then that way they can make adjustments after the fact. But, as far as long-term effects that are beyond 15 years of someone being on a medication, we're probably not going to know that. If they're not, not saying that there are definitely going to be things, but we're just not going to know what that's going to look like until probably for another 10 years.
All right. In the last couple minutes we have, talk about a little bit off topic, but let's talk about the Chris Deluzio and John Fetterman. You put a post out there this morning about them co-sponsoring a bill. Tell us about that a little bit.
Yeah, so there's a bill that was introduced both in the House and the Senate, bipartisan bill called the Patients Before Monopolies Act. What this would do is it would prohibit insurance companies and their middlemen, intermediaries from also owning pharmacies. Because what you have now is insurance companies and their PBMs, they own their own mail order pharmacies, they own their own specialty pharmacies, they own, in the case of CVS and Aetna, they own their actual own brick and mortar pharmacies. Right. And so this has created conflicts of interest where...
Well, they try to force you to use theirs.
They try to get you to use theirs. Even if they say they're not going to force you to use it, they financially incentivize you to use theirs or financially penalize you if you try to use a pharmacy of your choice. And so what this bill would do would just eliminate all conflicts of interest that has led to a lot of the patient steering and high cost, because what the insurance, you would think insurance companies actually want to reduce prices, but when they own the company, they actually want to bill themselves a higher price than everyone else, because then they could come back next year and say, hey, prices went up, we got to increase your premium, sorry, nothing we could do about it.
Right.
But yet all along it was just they increased the price that they charge themselves, so they can go and ask your boss, they can go and ask the government, they can go and ask the state for more money. People are starting to catch on to this. So this bill was introduced to eliminate that conflict of interest by saying that if you're an insurance or a PBM, you can't also be a pharmacy. Pick one or the other. Bills have already passed in Tennessee recently, as well as I think Arkansas or Oklahoma at the state level. But the PBMs, they're challenging this. They're saying, hey, this is interstate commerce. States can't interfere in interstate commerce. So if there was a federal bill that would be passed, this would eliminate that. So and thankfully, with our representatives here in PA, Representative Chris DeLuzio signed on as a co-sponsor to this bill. And then even on the Senate bill, Senator John Fetterman has signed on to it too. And then there's, also conservatives and Republicans in other parts of the country that have signed on to this. I think even in the Senate side, it's a Josh Hawley and an Elizabeth Warren bill. Like, when do you ever see those two agree on anything?
Right.
This is overwhelming bipartisan support. And again, would just eliminate that conflict of interest that we've been calling out for the 2 years that we've been open at Forward RX that we know exists. And that's why we operate outside the system to eliminate that. This would just eliminate that further. So I'd like to give credit where credit's due.
Right,
so
exactly.
I at least want to thank them for supporting that because I think it would be good for everyone in all healthcare.
All right. Lastly,